Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 10 minutes past 8 o'clock. It is Tuesday morning, the 6th day of January, 2026. Good morning and Happy New Year, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE, 90.9 FM over the air here in San Juan County, New Mexico. In Durango, Colorado, of course, we're broadcasting at 103.3 FM. And if you're listening to my voice anywhere else on the planet or on your device, you've gone to our website to do that, streaming from ksje.com, or maybe you're using the new KSJE radio app to tune in. We also want to welcome our viewers who are joining us here in the new year, the video of the program streaming out live to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. So glad that you are with us this morning, because coming up, we are talking to the San Juan Health Council, and they are going to be here talking about the Healthy Living Expo that is coming up in the next few weeks or so here. So stay tuned for that coming up in the next few moments right here on KSJE. It's Tuesday, of course, so that means also we'll be checking in with Amber Francisco from the Farmington Regional Animal Shelter. She'll be talking about some of the pets available for adoption this week, so stay tuned for that. And then, of course, Mick Hess will be here roving with the arts, so stay tuned for that as well. We'll be back with my guest from the San Juan Health Council right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care.
Now back to Studio A and the award-winning Scott Michlin morning program on KSJE.
Welcome back to Studio A this morning. As I mentioned, my guest from the San Juan Health Council, that's Amanda Evans, who is back with me this morning. Good morning. Happy New Year. Nice to see you.
Good morning. It's nice to be here.
Thanks for coming in. And we are talking about the upcoming Healthy Living Expo, which is back again for the new year, right?
Yep, third year in a row.
Good for you. Congratulations. And so you've got lots of things planned for this year's Expo. And so we should let folks know that it's on February 21st. So I misspoke earlier when I said it was later this month. It's next month.
Yes.
But it seems like it's going to be here before we know it.
It will be here before we know it.
So that was right. But coming up in February 21st, out at McGee Park again, because of you've kind of outgrown every other space, it seems.
Well, we're definitely growing. We've had, the first year we had about 50 vendors. Last year we had about 80. This year we're shooting for about 100.
Okay. So this is the time for vendors to call you and get involved if they want a spot?
Yes, they can. There's a QR code or a link to a jot form that they fill out, just giving us some, it's all free, but it's giving us some information on what size booth, what you're going to be providing, just so we can kind of make sure we have everything set up correctly.
Sure. And I know for our video watchers this morning, we're showing a QR code on the screen, and that's the QR code to take to point your phone at to register for a booth to get to that site, right?
Yes. And they can also, if they're not watching, they can go to our Facebook page, which is San Juan Health Council, and find the flyer there.
Gotcha. Very good. And so the whole point of kind of putting on a Healthy Living Expo like this, it kind of combines a lot of the health fairs that we've had in the past into one kind of bigger one-stop shop event. Is that the idea?
Yeah, the reason we call it an expo is a lot of times when we have a health fair, people kind of think of just local nonprofits and just medical, dental, those kind of things, and we definitely have all of that.
Right.
But we've also expanded into some holistic stuff, things you might not think of that fit. Even we do some booths that have like healthy hobbies you can come see. The first year we had a great person that came and did demonstrations on pottery because that's her hobby, and so it's just a lot of different, it's kind of more than you think of for health. It's kind of really expanded.
Got you. And so that's, I guess, a good point for potential booths as well, and vendors and things like that that are maybe listening to us this morning, is that if they think that their line of work or their hobby doesn't fit with the health definition, you've got a pretty broad definition, I guess, of healthy living.
We definitely do. We allow nonprofits. We allow for business. We do allow people to do sales if they have products they want to sell. We have demonstrations. Really, if you can kind of justify that it's healthy, and
right.
We are definitely willing to look at giving you a booth space.
Okay, there you go. So that's the idea. It is coming up on February 21st at McGee Park. Again, 10 a.m. to 3 p.m., kind of a midday event. Come and go as you want, and but you can spend all day there, but there's lots of information. I know a lot of folks look forward to it because they get a lot of good information from that event.
Yeah, we've had really great feedback. We had, like I said, our vendors increased, but our attendance also, we had about 550 the first year,
right.
And we had over 850 last year people attend. So again, we're doing some extra media this time even, and hoping to really get as many people out there. We've got some of the same booths that'll be there from previous years, but we've got several new ones. So if you've attended one of the previous years, there will be new stuff come again.
Right. Very true. And all ages type of an event too, I would say, isn't it?
Yes, we have single track out there that does like a bike area for the kids. We have senior stuff that people, so it's really an everything in between. There's really something for families, for singles, for really anybody who just wants to start the new year healthier.
Right, which we all do,
yes.
At least for the next couple of weeks while we have these resolutions still in our minds.
Well, that's why we picked February, because we thought, that's kind of when you're starting to slow down and you're starting to this is getting hard. So we want to give you some opportunities to find ways to fit those resolutions into easy life and make it, get you some resources to help you carry them longer than just January.
Sure, very smart. I like the way you think. So that's important. So that's what is coming up. And again, sponsored by the San Juan Health Council. And again, remind us of the San Juan Health Council. This is an organization that is representing and for San Juan County, and it works to try to promote healthy living and other things with its members in the Health Council, I guess, right?
Yeah, so the Health Council has been around for many years, since the early 90s. It started out as the Maternal Child Health Council, and then it kind of expanded into just general health issues. It's funded through Department of Health, is one of our funders. The expo is also sponsored by San Juan Regional Medical Center, because they have been a wonderful partner with this for us the last couple years. The Health Council itself is actually one of many in the state, so each county has their own health council. This system has kind of was set up because a lot of states have individual health departments within each county. We're lucky here in San Juan, we do have a health department, but not every county in New Mexico does. And so a lot of the health councils kind of take on that role of providing services or planning around those services, trying to bring people together so we're not duplicating. Have those conversations about what are the priorities we need to be talking about, and how do we fix some of these things or make it better.
Right, exactly. And again, the definition of health, I think, is a pretty broad one to be able to bring a lot of folks to the table to have those conversations about what can we do in San Juan County, for example, to make living healthier for our residents, whether that means maybe transportation or some housing issues or things like that, that could be certainly brought back to being healthy.
Yeah, those are conversations we have a lot because it is, people say the word health, and especially in the new year, you think going to the gym or going to the doctor or whatever, and those are all pieces of it. But the Health Council is really about being that broader, like, do we have education here that people have access? Do we have transportation to get to those medical appointments? Do we have housing? Do we have services for different pieces of the population? Even like businesses can be a part of the Health Council because you're looking at, are my employees healthy? We know if employees are healthier, they're showing up and producing better work. So there's all these people who might not think they're part of the health community really are. If you're a business owner or a small business or things like that, it can be helpful to have some of these discussions.
Yeah, very true. And so again, your meetings, I know, are pretty much open door to anyone that wants to come in and attend and find out more or maybe contribute to the conversation about what the Health Council is talking about any given month.
Yes, they're always open to the public. They're always third Thursday of the month. They're from 3 to 5. We try to end a little earlier than that, but we allow ourselves time because we can sometimes get into lots of different things.
Sure.
We try to have different presentations from community groups, from service providers to give resources to our members. And so they're right now they're being held at the PMS Marion Oil and Gas Community Room down at the community center. So you can just show up. Once in a while we don't have a meeting, so if you want to get on that list to make sure you know what's going on each month, you can email SJHC, San Juan Health Council, at sjcpartnership.org, and that will get you on our email list, and you'll get monthly calendar invites and updates about special events we're doing and things like that.
Got it. Very good. And again, the location is at the PMS Community Health Center down there in their community room, the Marion Oil and Gas Community Room, which is a great spot to have those. And so that's where you meet every month, usually, more or less. And but that's how folks can get involved as well. And they can come and go, I guess, and don't have to come to every monthly meeting or whatever, but to come and find out more about what is going on. And the Health Council's been an important part of the community, as you said, for a long time. And we're so proud to be a partner with the Health Council to present these interviews every month. We've done that for I don't know how many years.
I think we figured
too many to count.
This will be like 11.
Is it 11 years?
Something around, I'll have to go back and look, but
That's
I know we're around 10 or 11.
Nice.
So yeah,
Well,
it's been
good.
a while, a decade at least.
Right. And we appreciate all the members of the Health Council coming every month to talk about what they do and what they contribute to the Health Council as well. That's an important part of the partnership too. And of course, the San Juan County Partnership, which you mentioned in that email address, is kind of the fiscal agent and is kind of the glue that holds everything together a little bit, I think, with this organization, at least here in San Juan County.
Definitely. And that's each Health Council in each county is different. So some are their own 501c3, some are under their county government. We, for many years, have been under the San Juan County Partnership, and it works really well because that's a community agency and nonprofit that is already doing really good work in the community, and this is just one more program that they help support and help keep going. They put much more than just being a fiscal sponsor into it. You know, they give us space, they give us help, and they really have been able to help it keep going even through some of the lean years over the past while.
True. And I would say expertise too is important as well from the partnership. So thanks to them for that, and to the state, I think, for continuing to fund these throughout the state, because as you mentioned, some counties don't have health departments, and so in some of these more rural areas of our state, the Health Council is really the only kind of link to some of these resources and other information for those residents.
Yeah, and it really can be, like I said, each one's different. So some provide actual direct services. We don't, because we already have so many direct service organizations here, but they try to fill that gap, whatever that is, whether it's networking, whether it's planning, whether it's direct service. That's really the purpose of the Health Council, is to make sure the health in the community is being discussed and planned for and making a difference around it.
Sure. And I think, too, I guess that's why it's kind of left up to each individual county to determine what works best for them and the needs of their communities, rather than just having the state say, it's a New Mexico Health Council and here's what you're going to do in each of your communities from Santa Fe.
Yeah, they've been really good about giving us some leeway to work on what we want to work on. This year, all the health councils kind of have a focus on behavioral health based on the Senate Bill 3 that came out last year and has been helping to fund some behavioral health priorities. So the health councils have been asked to be a part of that planning process, attend the meetings, share information, and help in that. So they gave us this kind of overall, we really want some direction from the counties on behavioral health, but they're really leaving it to the counties and the health councils themselves to make some of those decisions on what does your county specifically need.
Got you. And that leads me into my next question for you, which would be kind of what is the year ahead looking like? So it's really a focus on some of this behavioral health needs of the community and how to address those, or what resources we have?
Yes, so what they've kind of done with Senate Bill 3 is they have divided it regions up. So our region is Region 11 based on judicial districts, and it's San Juan and McKinley County.
Right.
So we're working together with them, collaborating, trying to find, we just met in Gallup right before the holidays in December and did like a whole regional planning session. There's going to be a document that comes out of that lists kind of the top 5 priorities that the counties agreed on together. And some of those is, looking at, one of them is prevention and education, and that's kind of where the health council may fit in and where the partnership fits in and things like that. But there's other things like crisis management that we want to help support. And so all those are kind of that planning process where we meet together, and then there's going to be steps along the way where there's funding the state has for some of these projects, but also just how do we collaborate maybe as the two communities? How do we collaborate within San Juan County with behavioral health professionals to get some of these issues addressed?
Got it. And that's an important, I think, component too, I guess, is they're also, the state is putting their money where their mouth is to say, we want you to work on this, and we don't just want you to give us a report on it. Here's some money to back this up, and to say, give us a report, but then we'll give you some money maybe to make those recommendations actually happen, which is important.
That's what it takes to get some of this done. I mean, it's great. We can have all the conversations we want to and say, transportation's a problem, or crisis intervention's a problem, or this or that. But without money, we can't put those into place. So this really is something the state's doing to try to really make a difference around behavioral health. And we know that's an issue for all ages in our communities.
Right. And I know the other issue would be just finding those individuals who are trained in that field to be able to provide these services, and that is something the state maybe can't do as good a job at, but try to maybe recruit some of these folks into this community, into the state, to try to fill that need.
Yeah, that is definitely a conversation we had when we met in Gallup was, I think all communities across the state, maybe even nationwide, are really struggling to get enough providers on medical, dental, behavioral health, but especially behavioral health. We are definitely lacking some providers. We already have some great resources here in San Juan County. That's part of why we do the expo, is to get those information to the public in an easy manner.
Right.
And for people who might not use social media or something, it's an event they can attend and pick up information from. But yeah, it really is, that shortage means we need to also bring people, work on our workforce within our communities. Do we have kids here that could be trained and stay in the community? And so all those are discussions that happen on some of these regional levels and at the health council level.
Right, which is really important again. And again, important to know that these conversations are happening, because I know a lot of folks get frustrated when they are trying to find resources for their loved ones, family members, friends, whomever it might be,
Yep.
and to be able to know that maybe there are resources in the community, or will be, or they're working on it, or at least get folks in to see someone that can maybe be helpful. And I know the county and the navigation center and some other things that we have in place is also working on that too, which is exciting.
And those are all pieces to the health council. So like the county attends, Megan from the navigation center is at our meeting. She's
Right.
on our core team to help lead the health council. So we're not working, that's where I kind of said earlier, we don't want to duplicate services. We really try to encompass, we want as many people attending these meetings as we can, so that we're not doing something that some other group is already working on, or we're missing this big piece. And so all of that kind of is where we're trying to work together and really develop a cohesive plan and process for how we get these referrals to people and how we try to get people in as quickly as we can to address some of this stuff.
Exactly. And again, I think a shout out to San Juan County, who's been working really hard to set up the navigation center and be able to provide these resources to community members or get them the resources that they need right away, not to put them on a waiting list or things like that. I think that's also another important part of this conversation.
Yeah, we really, there's some great programs in this community, and we've got the Navigation Center. The partnership has a lead program that's law enforcement assisted diversion, and they work with the Sheriff's Office and different law enforcement and the county and the Navigation Center and PMS, and all of these groups are really connected behind the scenes that I don't think a lot of people in the community see, because all of it's kind of out of their eye when people are making referrals and making these connections and really trying to get people help as quickly as they can.
Yeah, and you mentioned law enforcement, which is another really important partner in this conversation too, right? Because they are sometimes, many times, the first people that come in contact with these individuals who are maybe in crisis. Yes, maybe they've broken the law, or maybe that they're having some kind of issue, but they're also in crisis. And so with the additional training, I think that law enforcement's getting, and to realize the resources instead of just throwing someone in jail, maybe the better use of the community dollars might be find them some resources, find them some assistance to get through whatever it is they're getting through, and avoid getting incarcerated, to try to get them back into be a productive member of society.
Right. San Juan County Sheriff's Office has a dedicated behavioral health deputy that works closely with our lead program at the partnership and with all these, the Navigation Center, all these different organizations. He's a point of contact where he can go out to some of these calls that are crisis calls and link them up with resources, with support right away. And so it's not like this long-term, like they have to wait 6 months to get on a list or something. And so there are those options out there, and there's always room for more. I don't mean to make it sound like we have every problem solved, because there's a shortage of different providers. We know we're missing at different stages, different youth. We're kind of short there sometimes on getting people help. But we really do want to make these connections, and that's what the Health Council is about, is these great programs and making sure they're connected to each other and to the community.
Yeah, which is great. And again, I think that's a good point, that yes, we still need more, but we still have some, and that's important to remember, that
Right.
It's not that we don't have any.
Yes.
And so folks that are in need of these services can probably find them with the correct referrals and information. And that's what the Health
Yep.
Council does, and what this Healthy Living Expo aims to do as well, for all kinds of different types of issues that folks may be dealing with, whether it's just their physical health, their mental health, behavioral health, all those different things, and much, much more, as we've mentioned, because hobbies and healthy living and all the things that you might want to do, you could probably, hopefully, find a booth that represents that at the Healthy Living Expo in February.
Yeah, there's so many things that go into our health, even into our mental health, that we don't always think about. There is that. We'll have therapists there that can give you cards and get you maybe set up with someone if you need that type of help. But maybe you do just need some, you need a hobby that's healthy and can get you out of your house and interacting with other people. And so, there's some of all of that goes into this. And there's different, like I said, there's something for everybody there.
Yeah, very true. So again, we will kind of recap a little bit about what we've been talking about with the Healthy Living Expo that's coming up on Saturday, February 21st. 2026 out at McGee Park, 10 a.m. to 3 p.m. The time is now, though, if you'd like to maybe get a booth, to register for a booth. And again, booths are free?
Booths are free. The event's free, so there's no cost. We've been able to fund this through San Juan Regional Medical Center and our Department of Health funding. And so we really this is a community resource. We don't want it to be, it's not a fundraising event or anything. We want to provide this as easy as possible for people to have booths and to show up.
Nice. And that's what makes it, I think, a bit different from other health fairs or things like
Yep.
that's provided for free, and the admission is free. And so it really is a great resource for folks and families to come out and find out about the resources in the community on this one day in February.
Yep.
So that's important. Again, the QR code is on the screen, but if not, you can also email the email address?
Yes.
Or go to the Facebook page for the Health Council?
Yep, both of those. We have SJHC at sjcpartnership.org or our Facebook page, San Juan Health Council.
Okay. Or just point your phone at the screen right now.
Yep.
And they'll take you there. Very good. Amanda Evans from the San Juan Health Council, thank you so much for coming in this morning. Always great to talk to you.
I love coming in. Thanks.
Appreciate you being here. Thanks. That's Amanda Evans from the San Juan Health Council, my guest this morning here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.